Acromegaly is a hormonal disorder that develops when the pituitary gland makes too much growth hormone during adulthood. When this happens, bones increase in size, including those in the hands, feet, and face. Acromegaly usually affects middle-aged adults, although it can develop at any age. If left untreated, acromegaly can cause serious illnesses and even death. However, available treatments can reduce the risk of complications and significantly improve symptoms. Understanding this disease is the first step towards effective management and better health. The lower jaw, or mandible, goes through a very important period of active growth during infancy and childhood. This is crucial for the proper development of the facial structure and the emergence of teeth. Starting at around 10 or 11 years old, the lower jaw, or mandible, grows more than the upper jaw. The development of the mandible normally continues until 19 years of age. Generally, the mandible reaches its bone maturity in early adulthood, although there can be changes throughout life. Jaw growth usually stops between 16 and 18 years of age. It is rare for it to continue growing after 20 years of age. If a specialist detects that the jaw continues to grow in adulthood, it is necessary to consult with a specialist to rule out problems with growth hormone. Class 3 malocclusion, characterized by a very prominent lower jaw, is a common symptom of acromegaly, an endocrine disease caused by an excess secretion of growth hormone in adulthood. The Acroscore is a tool developed to help diagnose acromegaly. It includes the following signs and symptoms: type 2 diabetes mellitus, excessive sweating, enlarged thyroid, carpal tunnel syndrome, gaps between teeth, and colorectal polyps. It is important for the following reasons. 1. It helps identify facial and oral characteristics associated with acromegaly systematically. 2. It includes the presence of gaps between the teeth as a characteristic factor of the disease. Gaps between teeth occur in 40 to 43% of patients with acromegaly. 3. It allows for quantifying and standardizing the evaluation of facial and oral changes typical of acromegaly. 4. It can facilitate early diagnosis of the disease by providing a structured way to evaluate clinical signs. 5. It is a tool that dentists and other healthcare professionals can use to suspect acromegaly and refer the patient for more tests. The Acroscore is important because acromegaly is usually diagnosed 5 to 10 years after the onset of symptoms. By providing a systematic method for evaluating facial and oral changes, which are often the first signs of the disease, the Acroscore can help reduce this delay in diagnosis and allow for earlier treatment, thus improving the prognosis and quality of life for patients. Dental diastema, or the spacing between teeth, has a score of 4 on the Acroscore because it is one of the most frequent and recognizable oral manifestations of acromegaly. Here's why it's so important. Frequency. Diastema occurs in a significant percentage of patients with acromegaly, between 40 and 43%. This high prevalence makes it an important indicator. Association. Diastema and acromegaly is not just a cosmetic issue, it is directly related to excessive mandibular growth, which is a key feature of the disease. As the jaw grows, the teeth separate, creating these spaces. Ease of identification. Dentists and orthodontists can easily identify diastema. Including it in the Acroscore increases the chances that a dental health professional will suspect acromegaly and refer the patient for a growth factor test with an endocrinologist. Early diagnosis. Diastema can appear relatively early in the course of the disease. By giving it so much importance in the Acroscore, the likelihood of an early diagnosis is increased, which is crucial for effective treatment and improving the patient's quality of life. In short, diastema has a high score in the Acroscore because it's a relatively common, easy-to-identify sign, directly associated with mandibular growth and acromegaly, and can contribute to an earlier diagnosis of the disease. Consult your doctor or dentist for more information on this topic.